It. Thank you everyone who's joining us tonight live. I'm honored to share on this topic of infertility. As Mary shared, I became a fertility care practitioner in 2012, so I've been working with over 200 clients in the last 6 years and have seen some amazing stories of restored reproductive health in women and families, particularly dealing with the symptoms of infertility. So first of all, I'd just like to share a disclaimer. I am not a doctor, so no part of this webinar should be taken as medical advice or diagnosis. This webinar is not a full study on infertility. It's only based upon my personal experience with couples struggling with infertility and my own personal research. So with that being said, I'm excited to share with you the things that I've experienced. So a little bit about myself. Mary gave a great bio, but here's a picture of my family. We did not have a struggle with fertility at the beginning of the time that we decided to grow our family. Aaron and I got married at the age of 30, and so after a short stint of use of birth control pills, came to find out that I had a deficiency in progesterone. We found that out actually after our daughter Abby, who's pictured there, after she was born. I found out that I had a deficiency in progesterone, which gave us a high risk of miscarriage, but it happened to be at the very same time that we learned about the Recurrent model fertility care system and Naprotechnology, which actually is able to find those underlying issues to help us to have restored reproductive health. We went on to conceive our second baby, which is Hudson there. He is now 4. And we were able to use progesterone supplementation before conceiving him, and then during his pregnancy, actually up to 32 weeks. Then we conceived our third baby, who is pictured there or represented by the bear, and her name is Ashley. And Ashley was miscarried at about 6 weeks gestation, and we did not have the correct supplementation needed during that time, which is the reason that we lost her life. Then our rainbow baby Wyatt, who is pictured there, was born in May of 2017, and so he just turned 18 months old now. So that's just a little bit about our family, so you kind of know where I'm coming from as I share this information. So at the Guiding Star project, fertility care education is very important, but particularly here at Guiding Star Orange City in Iowa, this program is really important to us because Guiding Star Orange City actually was developed from Orange City Fertility Care Center, which is what I launched in 2012, teaching the Recurrent model fertility care system. And we actually were able to develop Guiding Star Orange City out of that education system. So it's a core of everything that we do. We're passionate about educating women and couples of all ages about how their bodies work and how to appreciate and celebrate the natural, normal functions of fertility, childbirth, and breastfeeding. So why are we talking about infertility during tonight's webinar? Well, because these normal functions are not always working at the optimal levels. In fact, according to Resolve, the Infertility Association, they say that 1 in 8 married couples struggle with infertility, which is about 12%. And that's quite significant, especially when we consider the fact that 11.9% of women have received or inquired about infertility treatments. So at Guiding Star Project, we care for all women. We state that our mission is to celebrate and support the natural functions of women, and again, in the areas of fertility, childbirth, and breastfeeding. We claim to be natural, holistic, and life-affirming. So within every Guiding Star Center, you will actually find a natural, holistic, life-affirming approach to all areas of fertility, including infertility. So first of all, let's define infertility. The clinical definition from the World Health Association, they say that infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular, unprotected sexual intercourse. Whew. I, for one, have a few words in this definition that I have a major problem with. First of all, this word disease. Infertility actually is not a disease. It is only a symptom of an underlying health issue. So I really actually don't like to use the term infertility at all. I really prefer to say challenge or delay in achieving pregnancy. Mainly because I've been able to see so many women and couples overcome these reproductive abnormalities or unoptimal functions and being able to actually move forward to achieve natural pregnancy. So the second word there, failure, that I bolded, I just think that is quite a strong word to use in regards to a normal physiological function of female bodies. That is, I don't believe, a good word to be used in this definition. And then also this word of unprotected sexual intercourse. Really, I think that this is, I could do a whole nother talk on this topic alone, but I really don't like the idea of having to protect oneself from their committed partner, especially when we're trying to achieve pregnancy. So again, this is a clinical definition, and I think that we really need to redefine what this means, and we need to remap some truths about what infertility actually is. So some truths about infertility I wanted just to bring up. Number one, infertility is not a disease, as I shared. Infertility is actually a symptom of underlying health issues in the reproductive system. If you've ever heard of a diagnosis of unknown infertility, that really saddens me, because unknown infertility is not a diagnosis. It basically means that they don't know what's wrong, or that provider doesn't have an idea of how to find out what's wrong. And that really is a disadvantage for many couples dealing with the symptom of infertility. So again, infertility is only a symptom of that underlying health issue. So I've so enjoyed the ability of walking along couples and finding out what those underlying issues are and helping them to have a restored health. There is always an underlying issue and a reason for a challenge of achieving pregnancy, because, again, pregnancy is a physiological function of a woman's body. So there's something that's not working optimally enough that can be found to be able to restore her health. So that's really what we're getting at when we're talking about the symptoms of infertility. All right, so let's talk about causes. Basically, we know that there are some common underlying issues that make a challenge for achieving pregnancy. But because it takes a man and a woman to achieve a pregnancy, we know that challenges in achieving pregnancy can be factors for the man or the woman or both. And now again, the World Health Association states that it is about 1/3 male factor, 1/3 female factor, and 1/3 both. I'm not quite sure how accurate that really is, but it's a nice way of saying that it can be male, female, or both. Some of the main underlying issues that create challenge to achieve pregnancy for women are polycystic ovaries disease, endometriosis, and hormonal imbalances, physical or emotional stress, and organic issues, including polyps, fibroids, scar tissue, or blocked fallopian tubes. These can all be different factors. It's very rare, however, for there to only be one reason for a delay in parenthood. Usually there are several different issues going on that contribute to that delay or challenge. In fact, when we talk about the male factor, we often actually see couples with the male maybe having a low sperm count or mobility, but by actually enhancing the optimal health of the woman and the functions of the woman's fertility, they're actually still able to achieve pregnancy naturally when we're able to identify and treat those underlying issues of the woman. So it's pretty fantastic to see that when we find those underlying causes and they can be restored, that we can see success in natural conception. So next, let's talk about treatments. There's two different categories that I'd like to talk about. Basically, the traditional treatments and the restorative or cooperative treatments towards treating infertility. So let's first talk about the traditional methods. So within traditional methods, those would include our artificial reproductive technologies, the most common being IVF or IUI. These are in vitro, so outside of the body where the baby is created. And secondly, the blind medication. So I think about this being either way of a doctor or self-administered. So blind meaning that the medication is being given to see what's going to happen next, rather than actually targeting where the medication might be helpful or supplementing a deficiency that's going on in the body. So, these are very common. So with that, the goal of a traditional method is to achieve pregnancy. That's the main goal. So oftentimes we have couples who come and see us after they have used artificial reproductive technologies and they've failed. And that couple feels failures themselves. Again, we saw that word failure in the clinical definition. And it's again just burdens my heart that these couples have not actually been given a true diagnosis of what's actually going on there. So this goal to just achieve pregnancy kind of bypasses what's actually happening underlying in that issue. And the goal is just to get the woman pregnant. So there's some pros and cons to this type of treatment. Again, because the main goal is pregnancy, the support of that medical provider or provider in the infertility clinic, perhaps, that support pretty much ends at that point because it's a physical treatment. Whether they have a baby or not, that's kind of the end of the road for their services. So the pros to these traditional methods are the fact that treatments are given quickly, and the percent chance of success is given up front. So even if the percent chance of conception is very low, that is given to the couple right away. So that can be a pro if they feel that a lot of time has passed and they want to try a treatment quickly, then artificial reproductive technologies will do that. So that is a pro to this method. Cons, there are some cons. Oftentimes, no new knowledge or improvement of health is given with these methods, and they can be very expensive. They may need to be repeated for each pregnancy because with artificial reproductive technologies and related approaches, they're bypassing the problem to make a baby, again, in vitro outside of the body, which can cause many issues. The cost, side effects, and ethical concerns, which are have these moral implications of conception outside of a natural sex act and a high chance of loss of life of embryos or miscarriage. So the effectiveness of these artificial reproductive technologies are kind of difficult to see new stats recently, but I have some stats here that are from 2001. So you can see that this slide shows the types of cycles that are used in artificial reproductive technology. And you can see that many fresh embryos are created from different types, non-donor, donor eggs, and then total embryos transferred. And then the number of live babies born from artificial reproductive technology cycles, only 40,687 in this study. And you can see that that is a very low number compared to the number of embryos that were created. So in the yellow there, you can see that the ratio of embryos to live birth is 6.72 to 1. So the sad effect of that is that almost 7 lives are lost for 1 live birth. So the next slide here shows that the percent of cycles that result in pregnancy and the types of pregnancy. So 66.5% of these artificial reproductive technology couples that use this method resulted in no pregnancy at all. And then 12% of them were multiple pregnancies, and 1.7% ended in miscarriage, and then 0.7% in ectopic pregnancy. So really it was only 19.1% that achieved a singleton pregnancy, which would be considered a normal pregnancy. So with about a 19.1% success, I would say. No, multiples, of course, are success, but our bodies aren't supposed to, they aren't made to carry more than 1 baby, but we can do so with our advanced technologies today healthfully. But naturally, we would only want to carry 1 baby at a time. So it's very interesting, even if we put the multiples in there too with 12 and 19%, it's still a very low percentage of success with these artificial reproductive technologies. So weighing those effectiveness ratings with the long list of cons, we have to ask, is there a better way? And I believe there is. So we'll go back to our slide on treatments, and we had the traditional methods that we just talked about. And now let's talk about restorative reproductive medicine, or cooperative methods. And so when we use this word cooperative, it means that we're working cooperatively with the woman's normal natural cycles. Okay, so reproductive, restorative reproductive medicine, that definition is in any science approach to reproductive medicine that seeks to cooperate with or restore the normal physiological anatomy of the human reproductive system. It does not employ methods that are inherently suppressive, circumventive, or destructive. This approach respects the integrity of the human person and the right of women and men to have access to reproductive health care that respects their right to understand and cooperatively manage their own fertility with appropriate medical assistance. Oh, doesn't that definition just is it so uplifting? I love that cooperative and restorative medicine is truly what we need when we have a normal function that is working less optimal. So again, restorative reproductive medicine comprises of many different methods. The most well-known is Naprotechnology, which we have listed here, and that's the technology that I work with most frequently as well. They all share common goals of using information from a fertility chart and working to optimize normal functions. So there's also surgical Naprotechnology methods that exclusively use the Creighton Model Fertility Care System charting system. So if you were able to hear Teresa Kenny's webinar on endometriosis, it was fantastic, and she goes into way more in depth about Naprotechnology, or natural procreative technology, and how that's based on the Creighton model system. It's definitely worth looking into, and you should listen to her replay when you get a chance and when it's posted. But she goes into much more great detail of these functions of Naprotechnology in the surgical sense and the medicine sense. But together, these cooperative methods can treat the physical, emotional, and spiritual health, which allows for this holistic and life-affirming approach that we're really after at our Guiding Star Centers. So the place or the institution that uses this is called the International Institute for Restorative Reproductive Medicine, and it's the leading voice in uniting our providers and researchers who share a common belief that patients deserve scientific-based and well-researched reproductive health care services that cooperate with and restore reproductive function. Again, I just think that's outstanding that they are just wanting to restore health, because that's what's so important. So to address reproductive health problems, restorative reproductive medicine exclusively focuses on investigations and treatments, on identifying and correcting abnormalities while restoring or optimizing normal reproductive functions. So that's just completely in line with what we're working on. So there's actually several different programs that also work to support the emotional health. And one that we work with in the Guiding Star Centers is called Organic Conceptions. And I'll talk a little bit more about Organic Conceptions in a moment. But we want to talk about the goal. So the goal of restorative reproductive medicine or cooperative methods is to actually identify and treat underlying issues for restored health to allow for natural conception. So that's the main goal, is the woman's health. So this is very different from our traditional methods where the main goal is to achieve pregnancy. At this point, we talk about with our women that like their health is most important. So baby or not, this body that they live in, their health matters. So every woman's health matters, no matter if she's ever able to carry a pregnancy or not. So again, remembering that the woman's health is our ultimate goal. So there's many pros to using restorative reproductive medicine. First, it's holistic. So this allows us to touch on the physical, emotional, and spiritual support throughout the journey and beyond. So when we are going for this holistic approach, you're going to have cooperation between the fertility care practitioner or charting instructor, as well as the healthcare provider in the restorative reproductive medicine, which usually we work with the fertility care medical consultants. Those are doctors that are trained in Naprotechnology and trained in reading our Creighton model fertility care system charts that we teach at our centers. So couples receive fertility education and appreciation as they work through the charting systems for their normal physiological functions. And they are able to work cooperatively with their healthcare provider to solve their issues and restore health. So it's very different to sit down in the office of a fertility care medical consultant who is able to actually dialogue with their patients now, because their chart gives them so much information to be able to share and find the resolution together, which is very different from going into an infertility clinic where they say, well, this is what we think is wrong, so we're going to try this. The chart actually allows for dialogue with the couple together and their provider. So when treating for infertility or miscarriage, the restorative reproductive medicine physician treats the committed couple, the male and the female, as a single unit. So this process requires significant collaboration and communication between the two for their treatment team. And it is often successful in addressing underlying reproductive health issues. And this team approach, again, this holistic approach, supports their relationship, which can oftentimes be strained when dealing with the stresses associated with infertility or miscarriage. Another pro is the fact that the risk of miscarriage is dramatically reduced, and the treatments are morally acceptable for couples. So cons, there's actually only one main con that I could come up with, and that was that it sometimes takes time. to go through this process of identifying the issues and then treat it in a restorative way. So along with that, we always remind couples that we can't guarantee that you'll achieve a pregnancy naturally, but we can almost always guarantee that you will have some answers to why not. And that's a really big deal when we have so many couples walking around with a false diagnosis of unknown infertility. Having answers is huge. And it's so amazing how quickly we can get those answers when using a fertility chart and working with a trained fertility care medical consultant. So again, the Naprotechnology is accessed first by charting with the Crate Model Fertility Care System, which allows for the identification of the biomarkers within the menstrual cycle. And this then allows us to find the underlying issues. It's amazing when we have just one cycle of charting from a couple. As fertility care practitioners, we're able to identify right there in our follow-up sessions, wow, there's this issue, and this issue, just off of one cycle of charting. And especially when couples have already come from working in an infertility clinic with doctors that weren't able to come up with much, they are just shocked in how quickly we can see those underlying issues just on the paper chart. And then we're able to move forward with blood work to confirm what's going on. So that makes people really excited that they are part of the solution. So again, this allows us to find those underlying issues, and that working cooperatively with a trained fertility care practitioner and the trained fertility care medical consultant doctor allows us to work cooperatively with the woman's cycles and not to overarch or make it do something it's not meant to do. So the effectiveness of this approach with Naprotechnology is shown here. You can see that this effectiveness is with couples to achieve pregnancy with couples who have had a diagnosis of infertility. So with just using the Crate Model system alone, just charting and identifying the times of fertility, 20 to 40% of couples actually were able to achieve pregnancy. And then with the medical treatment of Naprotechnology, up to 80% of them were able to achieve pregnancy. So this is pretty outstanding statistics. And we have seen that happen here in our center, in our small center with about 250 clients. We found that we had over 132 pregnancies, and only 26 of those actually miscarried. So it's a pretty outstanding statistic in that regard. So next, let's just move on to our emotional health. I wanted to touch on this because emotional health is so very important. We've all heard stories of couples who stopped their treatments with their traditional treatments usually because they were just done. It just takes so much out of them emotionally in trying to achieve pregnancy. So we hear that these stories, they do this, they say, okay, we're going to stop and go towards adoption or fostering, which are wonderful ways to grow our family as well. And oftentimes the woman achieves pregnancy, the couple achieves pregnancy. And so we call these events organic conceptions because there wasn't one way or another that actually just made it happen, but it allows us to realize how much our emotional health is really, really important with that. So Mark Sherman and Kate Webster came up with an organization called Organic Conceptions, and Kate Webster is a psychologist, and she was able to work along with Mark, who had an organic conception with his wife as well, and to find out what is really going on in this situation, what happened in this couple's journey with their emotional health that got them to this point where their body began to work more optimally because they gave up the control or surrendered to their life situation. And they were able to find this roadmap that takes couples through this journey to parenthood, allowing them to understand the conception of doubt, and then going from being patient in their journey to becoming a medical patient. And then it gets to that point of surrendering to life. And we found that couples that went through this audio program, which is an 8-week audio program, they actually had a 42% advantage of success in natural conception. So this is a program that's available at many of our Guiding Star project centers, and Guiding Star Orange City does have this program, and we like to include it as much as we can into our overall program with our fertility care. So you can check out our websites for more information on how to sign up for that. But it's really important that we work with the emotional health with that as well. So that's how that holistic support happens. When a couple is dealing with infertility, we make sure that they have support not only just from ourselves as their healthcare providers with fertility care, but also with other couples that are struggling in this area. And usually it's the woman who is in these groups, but being able to share with others is really, really helpful. And as women have times when they have scheduled surgery or things like that, having others that have been there and gone through it to support them and pray for them is really helpful. So we have so many stories to share about really easy situations and more difficult. So I'll just say that we have a range of people who found out that they just had a vitamin deficiency, took some vitamin B6, and were able to achieve pregnancy very quickly within 8 weeks of charting, all the way to couples who have needed to have 3 separate surgeries to take care of endometriosis and polycystic ovaries disease, and then still had some time afterwards that they were still waiting to achieve pregnancy. But we've had some amazing successful outcomes in those situations. So there's a long range of time in the journey, depending on what the underlying issues are. So I want to encourage you to keep hope in the journey. Different things that we've seen that are very helpful in our clients that are on this longer journey towards parenthood, suggestions about taking a break. Sometimes when achieving pregnancy has just become a job, it's important for us to take a step back and think about the marriage as itself, right? So making sure that we're taking a break now and again and really focusing on the relationship. And sometimes during those break times, we see emotional health being restored as well. I always encourage couples to plan celebrations, especially at times when you might be going to do a test, take a pregnancy test on a certain time period, planning a celebration for that day. So no matter what shows up on that pregnancy test, you have something that you're looking forward to and something to celebrate your relationship, your marriage, which is definitely something to celebrate because that is a family. And then coming back to the basics, reminding yourselves of, we have a survey that we do called SPICE, which reminds our couples about their spiritual, physical, intellectual, creative, and emotional aspects of their relationship. And reminding them that on the day that they said I do, they said I do to this person. And stepping back and realizing, was it I'm with you in sickness and in health if we have children, or is it I'm with you anyway? And so stepping back and really looking at those basics is so important for these couples as they're going through. And the last one too, just the encouragement of don't stop living. A lot of people say, oh, we'll do these things after we have kids, or when I achieve pregnancy, or when this happens. And it's so very important that we continue to plan vacations, plan events, move forward in those things, so that we don't have to look back and regret and see that we stopped the very important parts of our life. And so recently I've seen some really awesome blogs from a few friends of mine that are going through this journey of delayed parenthood. One of them, The Waiting, I definitely encourage you to look up that one on Facebook. That's a friend of mine who's a fertility care practitioner, and she's been sharing about their journey of the last 5 years of working through the symptom of infertility. And she had some great insights recently about being thankful in her time of infertility. So you can look at the Orange City Fertility Care Center Facebook page, and that link is in there from the waiting. So lastly, I wanted to share just quickly about ways that you can lower your risks of infertility. Now, these are not guaranteed, but these are and of course, there's many different reasons why we have symptoms of infertility or reproductive abnormalities happening. But these are some things we can be aware of that can help. A lot of these things were things that couples had brought to our attention after a long journey. First of all, education of body and fertility awareness and appreciation. I truly believe that if we are taught this at an earlier age and before not understanding how our bodies actually work, and then having some time go on of a challenge of achieving pregnancy. Sometimes just the education of knowing how our bodies work and that fertility awareness is just so important, and for the woman and the man, and how that works. And so I was, again, 31 years old when I learned about fertility awareness, and it was way, way too late. So I am thankful for different programs that are helping this to happen for earlier on. So early detection of menstrual issues can happen by a fertility awareness charting, being able to diagnose issues for couples, even in their engagement time when we're working with them and charting and seeing that the woman might have some unoptimal functions going on in her cycles, being able to help them to restore that health before they even begin to start their family, or seeing that there might be a risk of miscarriage. Amazing. So definitely that early detection of menstrual issues is important. And basically staying away from hormonal contraceptive pills and devices that alter your body's natural functions of fertility. I can't stress this enough. I like to share with my clients often that when we allow our organs to work the way they are meant to, we lower our risks of being sick. So when we don't suppress our fertility with synthetic hormones, we lower our risks of those organs being sick. So we lower our risks of cancers. Even when it comes to breastfeeding, when we talk about not using hormonal contraception and breastfeeding as long as possible, those are the two best things to do to avoid breast cancer. So again, so when we're using those organs for what they're for, we lower our risks of getting sick. Also limiting hormonal disturbances. So this is a difficult one, guys. There's so many products and things in our atmosphere and our food that we're finding out all the time that are disturbing our hormonal functions. And there's not a lot of the things that we can do, but if there are major ones that you find out about, then try to limit the uses of those products, lotions, toothpaste, different things like that. Really trying to find those products that have less of those extra chemicals, the better. And our foods as well, the extra additives that are causing health problems. And lastly, limiting disposable hygiene products. This is not scientifically, this is completely my own theory and those of a lot of people that work together here in our area, but we're coming to find out that there are a lot of chemicals in disposable hygiene products, and a lot of women in our area are turning towards a green period, meaning using reusable products like menstrual cups and reusable pads, menstrual pads and things like that that are washable and don't have the toxic chemicals that are right next to that really vulnerable tissue in our vulvar anatomy that go right into our bloodstream. And I, for one, have the theory that that might possibly be part of our reason for this epidemic in hormonal dysfunction and endometriosis and things of that nature. So it's things to think about. And hey, being more sustainable in our usage is great. Average woman has about 400 cycles in her lifetime. So thinking about all of the disposable products that would be used with tampons and pads going into our landfills and such. Oh man, if we can discontinue some of that and limit that use, the better for our environment as well. All right, so just some resources for you. Just remember, if you are dealing with a delay in parenthood and need support or are looking for a cooperative treatment for your situation, then I would highly encourage you to contact your local Guiding Star Center or Fertility Care Center, because we would love to help you and walk along with you. So here's some of those resources for you. The guidingstarproject.com is where you can find out about the different centers that hopefully are in your area. And if there is not a Guiding Star in your area, contact us. Let's get one in every area, at least every state. We do have 7 states that have Guiding Star centers now, and that is growing all the time. The Creighton Model Fertility Care System, you can access those fertility care centers at fertilitycare.org across the nation and Canada are listed there. The center that I work for is Orange City Fertility Care Center. So if any of you are local, please contact us. We'd love to help you to start using the Creighton Model Fertility Care System. And our Facebook page is there that I referenced before. And on our Facebook page, we do have the recent post about the waiting, and then also a great article about how to support couples who are dealing with infertility. Things not to say and things to say. And I think that's something that is super helpful in that support that we need with our community. And sometimes couples that are dealing with infertility would love to have a list of this to give to their family and friends, especially with holidays coming up, parties and things like that. That can be actually very, very helpful. So it was an article written through Metro. So I just posted it today, actually. So go to facebook.com/OC Fertility Care, and you can see that there, and our website as well. And then, of course, our Organic Conceptions Program, their main website is listed here, but you can find that on Guiding Star Orange City's website, which is guidingstarorangecity.org as well. So that, thank you so much for listening to my webinar tonight. I think we might have some questions, Mary, if you're still there.
Thank you so much, Carrie, for all of that. We just got this question in. Leah says, "This is all so helpful, Carrie. Thank you. Can you share about how recurrent miscarriage can be addressed?"
Sure. Yes. Reoccurring miscarriage is something that we support often. First of all, the reason for miscarriage has to be identified first, and usually it's going to be a progesterone issue, and possibly progesterone and estrogen that's coming from a weak corpus luteum, which is the latter part of our menstrual cycle. And so when we are able to identify on the chart and then with blood work to confirm where specifically the deficiency is, because there is actually 7 different deficiencies in the post-ovulatory phase alone that Naprotechnology has special treatments for. And so we use bioidentical progesterone therapy to allow the cycle to be renewed and restored. And then in the pregnancy itself, we do progesterone monitoring, where we use IM injection of, again, bioidentical progesterone in oil. And we check every 2 weeks throughout the pregnancy until the progesterone levels are in the optimal level. So again, in the picture that I showed, my son Hudson, who's now 4, we did the progesterone therapy up to 32 weeks with him. And with my other son, it was up to 28 weeks. So it's different in every woman. And the traditional approach to that would be to just supplement the first trimester and then stop without ever even checking what the levels are. But with Naprotechnology, we're checking every 2 weeks until the levels are consistently in the optimal level before discontinuing the progesterone support.